Welcome to Costa Rica. My name is Johnny from Johnny Knows Costa Rica. Today we're going to talk about healthcare, but we're going to talk about the public side and the private side and their differences and what I need to take in consideration when I'm moving to Costa Rica and whether I have insurance or don't have insurance and what I should expect. Well, you know what? I'm a person that talks about healthcare but I worry about the future of what healthcare can be here in Costa Rica. One of the things that I'm going to talk to you about is the increased population of seniors in Costa Rica and what that means to the healthcare system. Because what happens a lot of times is people do not understand what that burden is, and it's not that it's the seniors' fault. You know what? They laid the ground that we walk on today, and they deserve us taking care of them. And that, if that means that, you know what, I thank you for what you did, because we're here today because you had the foresight to build on what we have here, and we're breathing every day. Well, you know what, let me get into a little bit about the private side when you're thinking about moving to Costa Rica. Look, there is a lot of private entities here. But what you have to take in consideration is when you're thinking about a private entity, what level of hospital you're going to be close to. There's actually 3 levels of hospitals: level 1, level 2, and level 3. Now, the level 1 particularly is that they can take care of minor things. They can get you, and what I call them is urgent care on steroids. They can handle your emergency, get you stable to the next level. But what you have to take in consideration is that where you live, how close are you to that facility, and how long would it take if an emergency happens to get there. So I'm going to give you an example. Now, maybe you live in Tamarindo, okay? Tamarindo is a beautiful spot. A lot of beautiful beaches, a lot of urgent cares around in the area. But you know what? If you have a very serious situation, do you have enough time to get to that facility? You know what? A lot of facilities on level 1 and level 2 are reasonably close, that you can get there within 15, 20 minutes. But when you get to the level 2 facilities, what happens is this, is that if you're in Tamarindo Central, you're about an hour running to get to the one public hospital and the 2 private hospitals. Now, is that enough time? I don't know. Is that enough time for you? Maybe you don't have that. Maybe you should consider, hey, you know what, maybe I need to live a little bit closer to health, depending on your chronic conditions. Now, I'm not saying that life should be revolved around a healthcare facility, but if you have chronic conditions or you have a history in your family, hey, you know what, I have experienced heart attacks, or I'm at risk of something, you have to think about where you're living. It's not just about that beautiful view, that landscape, or that greenery that's so beautiful, that is so Costa Rica. It's about your health. Now, that means that if you're thinking about living some of these areas, you know what? Make a plan. One of the things I do in my consulting sessions with a lot of people that look for our services is I make them make an emergency plan. What is an emergency plan in Costa Rica? Well, you know what? If you have a partner or you're by yourself, you do it in one of 2 ways. So you actually create a scenario and a fake emergency and see how long it takes you to get to that facility. Do you know the right roads, or do you need to put ways? Have you done it before? I'm sure that a lot of you have not done that before. Or maybe your partner is who drives all the time and you don't drive, and he's always driving or she's always driving. You have to switch the roles to make sure that one of you goes out and says, hey, you know what? I love you and I want to take care of you. So you know what? We're going to play a scenario to, hey, you know what, let's get to the hospital because you're having a heart attack. Hey, you know what? It's taken me a lot longer than I thought. And you do this more than once so you both are familiar what route to take, what I should do, how I should get there. Because a lot of people don't do this. Now, another thing that you got to take consideration is this. It's like, let's just say that you have the Caja, which is the Caja Costarricense of Costa Rica, the healthcare system here, and you have it. You know what, Johnny, I pay that into every month, but I never use it. It is the biggest mistake that you can make living here in Costa Rica. You know why? Because once you get to the hospital, let's say, you know what, let's call her Jane. Jane shows up and she's having a heart condition. But Jane is a diabetic. She needs insulin, but she's unconscious. Or, you know what, has faith into it. Her faith is different and she can't receive blood transfusion. But you know what, her foot is cut off. Costa Rica, by law, is going to save your life. And if they don't know nothing about you, they're going to try to save your life first and then apologize later. So this is what I recommend you do. Take the time, go to the device, get labs for yourself, find out how your health is doing. But the most important, when you're asking to get labs because you want to check yourself out, you ask them when you get in labs, you want to know what type of blood you have. Why is this important? Well, because when you get labs in Costa Rica, it's not automatic that they test for what type of blood you are. And inside EDOS, which is the Costa Rican healthcare EMR that you have your information in, it says what kind of blood type. And if when you did your labs, didn't ask for it and the doctor didn't request it, it's not going to be listed. This helps when they're treating you for a situation. Because like, you know what, Johnny, I have my private healthcare system. I have insurance. But you know what? Maybe your insurance provides you definitely healthcare with Clínica Bíblica, which is a great institution. I highly recommend it. But you know what? You're not close to it. You're close to a public healthcare system. They got to save your life. They need to know. So I'm going to leave you with this. I want you guys to promise me that when you do register for the Caja, or you do at least once a year, go do your labs, check in, so they have a record of who you are, what your conditions are. I hope this information was good for you. Pura vida, and always be safe.